And so if I take her to the doctor and I say, can you just enucleate that eye for us because she identifies as a one-eye, she wants to be just like her dad. What would the doctor say? They'd say, you're crazy and I'm gonna have you arrested. That's what they should say. And this is for a physiological intervention that is far less important than your actual gender and your reproductive organs. We have to stop this madness. This has gone too far.
Hi, everybody. Auntie speaks. Welcome back. So you might have seen some of these clips, but watch all of these. I tried to include everything that I could possibly find. So this is a debate that was held in the House on gender affirming care. And you're going to see arguments from the left and arguments from the right. And hopefully when you're done, you're going to see who are the crazy ones. Who are the extreme ones? Let's see.
So let's shift focus to the giant elephant in the room. And this is the reauthorization for the Children's Hospital's GME funding. And yes, it's true. This is my bill. And what it does is it withholds funding from these hospitals if they engage in what they call gender affirmation therapy, these physical changes to a child's physiology, permanently disfiguring them through either puberty blockers or even surgical modifications. Now, look, I understand that the other side of the argument here believes they are on the side of compassion, and maybe that's a sincerely held belief. It is just as true that I believe we are on the side of compassion. I think it is indeed compassionate to stop kids from being permanently physically altered based on little to no evidence that it will improve their underlying mental condition. Now, why is this controversial? That's actually beyond me. Not too long ago, I think we all agreed that performing double mastectomies on a 12-year-old girl was wrong. Now it's become a political movement where radical activists have bullied mainstream medical associations and members of Congress into repeating this propaganda. Now, it should be noted that in the public, this subject is actually not very controversial. In fact, a recent poll just last month by the Washington Post showed that 68% of Americans opposed using puberty blockers on children. That's just a question about puberty blockers. Imagine if the question had been about castration or surgical interventions. So you've got to convince me that 70% of Americans are just a bunch of fools that refuse to accept the so-called science. Or maybe, I have another theory. Maybe they have a very baseline understanding of ethics and common sense, which tells us that maybe, just maybe, it's a bad idea to submit children to permanent life-altering medical interventions based solely on a temporary ideation about their gender. Gender affirmation is not science, and there's no evidence-based standard of care. To say that is a lie, or is at best redefining the term evidence-based. What this is a social contagion. It is based in pseudoscience and radical ideologies. And it's sweeping across our country and encouraging children to make irreversible changes to their gender. What's worse, it's coming from adults and institutions who know better, to include our children's hospitals, and institutions that are supposed to be tethered to sound science and their Hippocratic oath of do no harm. Now, maybe I'm an optimist, but I do believe that science and evidence will win out in the end. And in the future, we will look back at these gender-affirming therapies as we now look at lobotomies and electroshock therapies. I have some reason to be hopeful. Notably, Great Britain's National Health Service restricted these clinical interventions for minors just last week. Reviews published in the British Journal of Medicine, the Journal of the Endocrine Society, even in the American Academy of Pediatrics, all cite the lack of evidence. I'm going to submit for the record this review published in the Journal of Endocrine Society that found that there is, quote, low-quality evidence for the idea that hormonal treatment improves quality of life, depression, and anxiety among adolescents. Now, here's the important part. This was a systematic review, which by definition is not cherry-picked data, but it's an all-encompassing review of all the data. It has thoroughly debunked the notion that any of these treatments are, quote, evidence-based, let alone recognized as, quote, standard care. My colleagues are using these terms not as accurate representations of the data, but as propaganda. Now, this funding program is reauthorized every 5 years. It provides taxpayer funds to train resident physicians at children's hospitals across the country. It's true, it's been a bipartisan funding mechanism for years. Let's keep in mind something, though. This is taxpayer money. And when 70% of taxpayers oppose these barbaric treatments on minors, then taxpayer money should not fund it. That's why I'm stipulating that as part of this reauthorization, we will not provide any funding through this program to children's hospitals that push gender transition on minors through puberty blockers, hormone therapies, and surgeries. Let's be clear, because there's another lie that's been told. It does not prevent any mental health therapies at all. despite these lies being told. It does not prevent those kind of therapies at all. This is the issue of our time. This is a hill we're going to die on.
Yeah? Pretty good, huh? Very rarely do I watch a politician give such an impassioned and logical thought process. Politicians are not my favorite people. To tell you the truth, I hate most politicians, both on the right and on the left. Okay? But this was a wonderful argument. This is an argument that is based on the Hippocratic Oath, which says, do no harm. If what you're doing is going to do more harm than help, then you cannot do it. And Dan Crenshaw here is just taking it one step further, which says, look, if we don't have good evidence that this helps, and number two, you're doing it on minors, and there's a lot of evidence that there might be harm, and 70% of the population of the United States disagrees with it, then at least let's not fund it with taxpayer dollars. Who's the radical ones here? Who are the crazy ones? And guys, help me out. Put in the comments below. I tried to find this entire committee hearing. I searched for hours. I could not find it. I only could find clips that were put out by other people. So in the comments below, if anybody does find the full clip of this, I would love to see the testimonies of everybody else who was on that panel, but I could not find it. So if you do find it, please link it in below in the comments.
We keep hearing this is a politicized issue. This is a manufactured culture war. I got to say, we aren't the ones who did that. We aren't the ones that came up with this radical new movement that is performing permanent physiological changes to children with no evidence of any benefits. We didn't start that. We're just trying to stop it because it's crazy. It's a contentious issue, which almost 70% of Americans oppose. So we are just saying here that taxpayer money shouldn't be used for it. That's all. This should not be that controversial of an issue. The questions are for Dr. McNamara. I just want to ask you, honestly, you're not concerned about the unknown effects of puberty blockers, hormones, and surgical interventions in kids, the long-term effects, not concerned about that?
Everything I've said here today comes from a place of deep honesty and conviction for the care that I provide and the community that I'm a part of.
You've said that we've cherry-picked data. How do you mean how do you mean that?
So it is very unscientific and flawed to pick a single study or a single statistic and to discuss it in isolation.
Totally agree.
Medical experts are able to talk about all of the evidence as a whole.
Totally agree. So it's good to look at systematic reviews, right? That's the gold standard of evidence when you're trying to understand whether something works or whether it doesn't. So the British Journal of Medicine looked at 61 systematic reviews with the conclusion that, quote, there is great uncertainty about the effects of puberty blockers, cross-sex hormones, and surgeries in young people. The Journal of Endocrine Society came up with the same conclusion, even the American Academy of Pediatrics. They all cite the lack of evidence. And so here's the thing. If you're doing a therapy, and it's, temporary, whatever, fine, maybe let's try it, let's see if it works. But when you're talking about permanent physiological changes, do you not agree, just from an ethical standpoint, that you might want extremely strong evidence of the benefits? And there is no systematic review that states that there is strong evidence of benefits.
Sir, are you aware of how the quality evidence grading system works and how it's applied?
Yeah, we've read through it. That's why I'm citing these journals. So which journal says something different? We should have that debate. Tell me a journal that has done systematic reviews that cites different evidence, that cites strong evidence for benefits of these therapies.
The standards of care were developed based on extensive...
You're not telling me any journal, you're not telling me any study. Don't say standards of care.
Yeah. So...
Tell me one.
The standards of care.
That's the standards of care. That's not a journal, that's not a study. That's not an organization, that's not an institution. You're just saying words. Name one study.
So this is the clip that has gone viral. But what I want to point out is very different from what everybody else has pointed out. Yes, Dan Crenshaw just wiped the floor with her. But this is a larger problem that we have right now. This is what the left does. They say science, 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 and behind them is smoke and mirrors. The emperor has no clothes. Anybody comes to you and says, the science. You don't trust the science? The science say, experts say. Anytime someone says that to you, you should immediately discount their argument. Unless they're talking about gravity or relativity or Boyle's law, something like that, then science doesn't say. And when anybody says that to you, they are lying. They probably don't even know that they are because they don't understand science.
I want to run everyone through this thought experiment. So my daughter's going to grow up with a father with one eye. And at some point she might say, I want one eye. Right? I identify as somebody with one eyeball. And so if I take her to the doctor and I say, can you just enucleate that eye for us because she identifies as a one eye, she wants to be just like her dad. What would the doctor say? They'd say, you're crazy and I'm going to have you arrested. That's what they should say. I asked before about what evidence is there that there's benefit for these so-called standards of care? I mean, anyone can say that they have a standard of care, but it has to be based on some kind of evidence and research. And when you've done systematic reviews, which is the gold standard for how you come to a conclusion within the scientific community, systematic reviews of 61 other systematic reviews, and you find little to no evidence that there's benefits for this, maybe you just press pause. Maybe you just press pause. Because if we're doing permanent physiological interventions to children that have permanently disfiguring them for some hope of a benefit that is not conclusive, then maybe we should press pause. That's all we're saying. Press pause. And actually, that is even less than that. All we're saying is let's not put taxpayer money toward it. Dr. Grossman, you're a child psychiatrist. Can you expand upon the profound lack of clinical reviews and the long-term impacts of these treatments, puberty blockers, hormones, and surgeries?
Well, yes, as I said, we don't have the kind of studies that we would like. And I think it's very important for people to understand that when we talk about standards of care and we talk about guidelines and all the various associations that have come out for gender affirming care and about politics and partisanshipness, those organizations themselves are rife with politics. They are permeated with politics.
Can you expand on that? Tell us how those activists have pressured dissenting voices in this
Well, yes,
field.
I just interviewed a number of doctors for my book, pediatricians, endocrinologists, who reported back to me on the fact that when they tried to speak up and have panel discussions or presentations that challenged gender affirming care at the American Academy of Pediatrics or at the Endocrine Society, they're simply not given that opportunity. Even people, who have writing articles, the articles are turned down by a lot of journals. People have to understand that politics medicine, unfortunately, is permeated with politics at this point.
This is Dr. Miriam Grossman, and she is bringing up a very serious problem we have in the scientific industry right now. It is being controlled by politics, okay? So whatever the political flavor of the month is, that's where all the money flows to and research follows. But it's even worse than that. We now have something that's called PAL review. And what that means is if you try to get published, you get a bunch of your buddies to say, oh, I peer reviewed this, and it gets published. So the only thing that gets published is what's politically favorable, i.e. climate change, gender politics, so on and so forth. If you are against any of those things or you have a nuanced argument, you don't get published. But it's even worse than that. The money that flows from the government also changes the results of research. Okay? Can the source of funding for the medical research affect results? And I'm going to flash this up. I'm not going to read all of this, but basically there was a couple of studies that found that when you have a for-profit company testing, they find for a newer treatment, when it's a nonprofit testing, they find half of that result. What does this mean? That means that science is now biased. It's not trying to find the real result. When you have a hypothesis, you are hypothesizing that A will happen, but B could happen. And you're supposed to test equally to see what happens. In the United States now, we have something crazy like 90% of positive results. What that means is that when you do a test, when you're testing a hypothesis, you said that A was going to happen. And now 90% of the time they come out with the results that A happened. In science, it doesn't work like that. So our entire scientific apparatus is broken. Please comment below on whether you want me to do a full video on this. It's a topic I'm very interested in.
Thank you for the opportunity to address you. My name is Miriam Grossman. I am a board-certified child, adolescent, and adult psychiatrist, author, and senior fellow at Do No Harm. I have been taking care of patients for 45 years. I'm going to use my time to respond to Dr. McNamara. First, I'm struck by her use of the phrase, sex assigned at birth. Sex is not assigned at birth. Sex is established at conception, and it's recognized at birth, if not earlier. Dr. McNamara claims that her views are science-based, but to claim that sex is assigned at birth is without any scientific basis whatsoever. Its language misleads people, especially children, into thinking that male and female are arbitrary designations and can change. That is simply not true. Dr. McNamara claims that social and medical interventions are the only evidence-based treatment and that scientific evidence shows it is life-saving. Without it, she's warning us, kids will commit suicide. Well, a growing number of countries have effectively banned the care to which she's referring. And thank God there's been no wave of suicides or other mental health catastrophes. 3 years ago, Finland placed strict limitations on medical interventions for minors. Sweden did the same thing after a 14-year-old girl was found to have osteoporosis and spinal fractures from puberty blockers. An investigation concluded, quote, the risks of anti-puberty and hormone treatment for those under 18 currently outweigh the possible benefits. The UK conducted a review and called the evidence very low. They've also placed severe restrictions on the care that Dr. McNamara calls life-saving. Norway also analyzed the data and has made similar changes in policy. The National Academy of Medicine in France warned, quote, great medical caution must be taken in children and adolescents given the vulnerability of this population and the many undesirable, even serious complications the therapies cause. Doctors in New Zealand and Australia have published similar statements. Is Dr. McNamara suggesting that all these countries are rejecting evidence-based treatment and placing their kids at risk of suicide? Regarding that point of view, Finland's gender expert, Dr. Rita Kaltiela, said, quote, it's purposeful disinformation, the spreading of which is irresponsible. All 7 countries, and Florida too, of course, concluded that kids don't need their development interrupted, the girls don't need their periods stopped and their voices lowered, and the boys don't need to grow breasts. What they need is psychotherapy. I have other objections to Dr. McNamara's testimony. She insists that her position, only hers, represents standard medical care. What she doesn't want you to know is that there is no standard. There's a debate. There's a fierce debate. And on the side opposite her stand such prominent figures as Stephen Levine, Kenneth Zucker, Paul McHugh, and James Cantor, among others. These doctors are giants in the field. They have been treating transgender patients and gathering data and publishing papers about them, and I mean no disrespect here, but since before Dr. McNamara was born. The point is that those veteran clinicians and others who have wisdom and experience are ignored because they disagree with the current narrative. They're against medical interventions for the same reason those 7 countries are. There is no evidence of long-term benefit, but there is evidence of harm. I'll end by quoting Jamie Reed, the courageous whistleblower from the Children's Gender Clinic in St. Louis. I believe that hospital receives the medical education funding that we're discussing today. She said that doctors at that clinic said, "We are building the plane while we are flying it." We are building the plane while we are flying it. That's how they described the treatment at their gender clinic.
Mic drop. That's it. That's all that needs to be said. So guys, please like, comment, and share. We need to get this argument out there. Comment below. Who are the crazy ones? Who are the extreme ones? Is it us or them?